focus on issues concerning mental health and disability. Basically, it's the Sumbi Jumidi, which is a program that is centered towards the promotion of mental health and disability here in Ghana. We started this conversation last week when our guest joined us for us to talk about various issues within it and narrowing down to the specific challenges that we have within that particular area or that sector. Today we'll continue with that discussion. We're focusing on investment this time around. Why there's a need to invest in mental health and why there's a need to invest in disability issues. And how have we fared so far as a country? Are we committed to investing much into it? I guess to answer some of these questions and even more. So I have in the studio next to me Dr. Augustina Name. She is a senior lecturer, Department of Social Work, University of Ghana. Good morning to you. Hope you're good.
Yeah, do you well?
Right.
Yourself?
I'm well, thank you. And then we have James Sambia. James Sambia is a former Executive Director, Ghana National Association of the Deaf, and is currently the Project Officer for Henry Jabba Memorial Foundation. Good morning to you, James.
Good morning.
Hope you're good.
I'm very well.
Good. And then we have Professor Justice Novino. He is an Associate Professor, School of Public Health, University of Ghana, Lagos. Good morning, Prof.
Good morning.
Hope you're good too.
Doing well.
And good to have all of you.
Thank you very
much. James, you were here with me last week, so if we can just briefly recap what we talked about last week, then we can move into our conversation for today, which I'll start with Prof. We talked about how addressing those challenges we find in mental health and disability and how far we've come as a country. Just and a summary on that, then we can move on. Just what we started last week. Yeah.
Okay. Last week, I think the topic was on accessibility.
Accessibility.
And we're trying to see how facilities can be made accessible for persons with disability, including persons with mental health.
Yes.
And I think, in summary, we agreed that there were key areas that the government needed to look at in terms of accessibility.
Yeah.
And I think we also focused on the 88 hospitals that the government promised to build last year. And we're looking at how these hospitals can be accessible to persons with disability, including persons with mental health issues. And then we also agreed that, well, it was important that persons with a disability also be on the lookout for the designs. We've not seen the designs yet, which is with the Ministry of Health. And so we needed to look at the designs to see whether accessibility issues concerning persons with disabilities were factored into the designs. And if not, then we'll take it from there and find out what to do next. So basically, I think
that's just a summary of what we touched on yesterday. So I'm going to start off today, and Prof, I'm starting with you on this. And the focus is on investment. So if we talk about investment in mental health, exactly what are we referring to?
Okay, thank you very much, George. Investment is investment, like in any business. Investing in mental health means galvanizing the resources, mobilizing the needed resources from all sectors, and putting them into providing, more infrastructure, more better trained personnel, ensuring that people with mental health conditions have access to the needed services, unhindered access, in fact, that their use of health services do not bring any financial catastrophe on their families. So whether or not they have money, they're able to easily access this service. So it's in totality, ensuring that as a country we're able to increase our spending on mental health. Everything that has to do with that eventually supports the use of services by people with mental health conditions.
All right, Doc, same question.
Yes.
Investment.
Thank you so much. I want to use this opportunity to say good morning to your cherished viewers, and good morning to you.
Thank you. Good morning to you too.
So, evidence out there by the World Health Organization indicates that there is a treatment gap of between 85 to 98%. So what that means is that about 98% of individuals who require mental health services do not have access to the services, either because they don't have the money, because National Health Insurance doesn't cover that,
actually cover that,
or because the services are far away from them. Right now, as we sit, it is nothing new. We all know that. We have just 3 mental health facilities, and they are all located in the southern sector. So think about those in the northern sector, those in the middle belt. So somebody, let's say, from my village in the northern region, Pandai district, who has a severe mental health issue, transporting the person all over from that place to this place is a huge issue. And yes, and usually when it happens like that, family members will have to accompany the person. So we have about 2 people accompanying somebody who has a mental health condition. Think about transportation and all of that. So yes, these are very huge issues, and this is the reason why we have to finance mental health services. Apart from that, I think Prof just mentioned that we also do have inadequate personnel. So when we talk about psychiatrists, how many of them do we have in our country? Psychiatric nurses, how many of them do we have in our country? And there's also evidence that only 1.4 of the revenue or expenditure for the health sector is actually allocated to mental health. These are all issues that we need to tackle. There's a need for more resources to finance mental health services or issues, so that, like Bob said, everyone who needs those services should have access to it. It is a human right issue. You need healthcare, you should have it.
All right, same question.
Yes. So I think that I want to look at it from 3 angles.
Yes.
The first angle is the legal angle.
Okay.
Legal or the judicial angle, if you like. If we look at Ghana is a signatory to the United Nations Convention on the Rights of Persons with Disabilities. And so we are legally bound to be able to implement some of the articles in the provision, in the convention. And so if we look at Article 25, which deals with healthcare, you realize that there are issues related to affordability and services, whether these services are affordable, whether they are even accessible to persons with disability. And governments are enjoined to ensure that all these things are made, accessible and affordable to persons with disability. So legally, we have a responsibility as a government to provide services for persons with disability, including persons with mental disabilities. That's one. The second area I want to look at is to deal with, I don't know whether it's moral or something, but I think that as a country, we have a responsibility for persons who are vulnerable. We have a responsibility because, and permit me, I don't know, maybe I don't have a better example, but if you have a child at home and you have a teenager, which of them is more vulnerable? The child.
Yeah.
And so you need to pay more attention to the person who is vulnerable. And we know that persons with disability are vulnerable, and so they need to be taken care of. We need to pay attention to them. So I don't know whether that's the moral angle. So the government, we have a responsibility to ensure that we take care of persons who are vulnerable because they need our support. And then thirdly, I would look at the numbers, data. As Dr. Nami was saying, we know that from data, we have approximately 2.8 million persons who are persons with mental disability in Ghana.
2.8 million.
2.8 million.
That's a lot.
It's a huge number.
Yeah.
And so we cannot discount 2.8 million. And we know that in Ghana, elections have been won with much, much less numbers.
Even 500,000.
Even 500,000.
Yes.
So it means that if we have this huge number and they are not contributing to the economy because of their state, because of their mental state or inability to be able to contribute, then I think that we ought to look into it and see what we can do to ensure that at least there's more investment in the area of mental disability so that they can also contribute their quota to national development.
I mean, looking at the numbers, and I'm starting the session with you, James.
Yeah.
Looking at the numbers and the experience so far, you think as a country we are much interested in investing in mental health issues and disability issues?
Well, I think that, again, let me start from the point of statistics.
Okay.
I think it's also stated that 1 in 4 people, out of 4 people, one person is likely to have a mental disability moving forward. And so, as a country, we should be looking at how can we ensure that instead of 4 out of 1, we have maybe 10 out of 1 or 20 out of 1. So it means that we need to invest to reduce that, bad, statistics. And so I think that it's very important that and statistics is important because it's not only for, it's for planning and for development.
Sure.
If we are not able to use numbers to develop or to carve out issues that we can use to promote development, then I think that we are not doing ourselves any well. So statistics for me is also very important.
Right.
We should look at it. And I think that if we convert 2.8 into percentage, you realize that it's a huge percentage.
Yeah. Right. Prof, do we have that kind of need in the agency to invest into areas like this as a country?
Well, thank you very much again. As a health economist, let me take it from the economic perspective.
Great.
Continue with what Dr. Graham said. Our mental health service delivery in Ghana is largely dependent on donors. Largely. And Dr. Nami mentioned that the health insurance scheme does not
cover.
I don't know if a few days ago that got covered, but as far as I know, it does not cover.
It doesn't cover. Yeah.
Now, the economic perspective, and for me, the first reason we need to urgently invest in mental health is that it makes a lot of economic sense. It makes economic sense because, governments or firms or businesses, I mean, he talked about the numbers of people with mental conditions, and we know that depending on the mental condition, your ability to contribute to production is limited. And so, for instance, it's been estimated that up to 7% of Ghana's gross domestic product, essentially the country's income annually, is lost due to mental conditions. Or, in other words, we could have achieved 7% more if we actually invested in mental health. A recent study that we did in Ghana on schizophrenia, on anxiety disorders, and depression showed that the returns on investing in depression, for instance, is 7. So what it means is that if government invested, or anyone else invested 1 Ghana cedi, 1 additional cedi, in managing depression and then making sure that people with depression have access to treatment and all that, we're going to, if we to quantify the benefits, it will be 7. And so forth and so on. And for anxiety it was 5, and then for schizophrenia it was 2. So picking from the economic perspective, I mean, any government knows that anything that expands your benefits makes sense to invest in, even for companies. I mean, if you are losing a certain percentage of your profits because some of your staff are not well, they come to work, they cannot really produce well, so you essentially don't get your outputs. You would want to close those loopholes. And for you, as far as it touches profitability, it is an urgent thing for you to do.
But do we recognize that agency? Do we recognize that advantage it holds?
I think it's for one of those reasons that we are here.
Sure.
Because as I said, if we really did, we won't be spending 1.4% of the health sector budget. 1.4% not of Ghana's budget, of the health sector budget. I mean, for 2020 pre-COVID, the budget for health, the entire health sector, including everything that goes to the health insurance scheme, was about 9 billion cedis. So 1.4% of that. So, we know that the government's Ghana Beyond Aid agenda, and again, that donors are transitioning. They are moving because we are richer, we are lower middle income country now. So if donors leave the support of mental health in Ghana now, I'm sure we'll find some problems. Maybe we need to treat it as an emergency like COVID to raise emergency funds. So I think that I am not sure we do recognize that, but that is one of the reasons we are embarking on this this advocacy, that it is important for us to urgently look at mental health. Of course, I've restricted myself to the economic perspective.
Yes.
But there are the other health parts, which I'm sure my colleagues will talk about. It simply reduces the burden on the health system. And I think that as a country, we need to really sit up and rethink our approach to investing in mental health.
So, the same thoughts and same questions, so whether we've recognized the need for something like that.
I think I will agree with Prof that if that recognition is there, probably we would not be sitting here talking about it. But it is very important that the government, all of us, recognize that it's high time that some of these issues are addressed. Because 2.8 million individuals with mental health issues or conditions.
And these are the ones that at least you have.
That we know of,
yeah.
and this statistics is a couple of years back, so we don't even know, and we are sure that with COVID and all of the anxiety, depression, fear, panic, and everything associated with COVID, this figure could even be higher. You know, so for me, what I always tell people is this: there is power in inclusion. Prof mentioned 7% of GDP. We lose that every year because we don't address these issues. So let's assume that we invest in mental health. Those who need services, they get whatever services they need. They are able to participate in their communities, in their society. They can contribute to GDP. So what sometimes we don't recognize is this. So once the individual is able to participate freely in mainstream society, it increases the self-esteem of this individual, the dignity, and above all, the person also receives income. It empowers this individual. So this individual who before was being supported by family members now can take care of him or herself, family members, and can contribute to the community at large. So there's power in inclusion. So the burden on the family is reduced, because right now there's a huge burden of care even on family members, apart from the government or apart from the health sector. On the family, there's a huge burden of care. They provide a lot of finances, or they finance their individuals who have mental health conditions. You know, so they take care of almost their everything, right? Psychological burden, social burden, and so on, physiological burden, and so on and so forth. So there's power in inclusion. So if we are able to pay attention to these needs, it's going to benefit us all in the long run. And I always say one thing, you know, we do have sustainable development goals. There's this agenda that by 2030, we will have economies that are developed, and the development is sustainable. And the core central value of the SDGs is that we don't want to leave anyone behind. So if we are not investing in mental health issues, that means the goal 3, which talks about promotion of health and well-being for all of us, we cannot achieve it come 2030. And 2030 is not far from here. We are in 2021, just a few years from now.
Just 9 years.
And not only that, it trickles down to the achievement of other goals. Once we are not able to achieve goal 3, it makes it also challenging to achieve the other goals. So for instance, the individual is unwell, we are losing resources, the individual being unwell means that the person doesn't get also the resources that they need to take care of themselves, the burden on the family, and so on and so forth. So now we are looking at goal 1 of the SDGs. We can also look at goal 8 of the SDGs, because the person will not be working. Right? We can also look at so many of the goals. And what I always say is
education and all that.
Or education, goal 4, goal number 4, and so on and so forth. So at the long run, come 2030, if we still have one person who is not meaningfully participating in mainstream society, what does that mean? We are leaving somebody behind. Yeah. We cannot go and leave anyone behind. So that means the UN probably may have to go back to the drawing table. And I don't think that is what we want to see. So there's urgent call on all of us to ensure that we invest in mental health and also disability issues in general. It's not just about mental health, or persons with mental health conditions. Last week, our colleagues here discussed largely issues around those with physical and other disabilities. We all need to take this seriously, that we cannot achieve SDGs come 2030 if a single person is left.
Yeah. You've all interacted with policymakers and those in leadership affairs. You've also had experiences outside and all that, I presume. When interacting with these policymakers and our leaders, I would say the politicians and all that, what sense do you get? That they understand the issues or they just do not care? Doc, I'll start with you on this. Doc, I'm starting with you on this particular. Because
I thought I had profs.
You want profs to go?
No, I thought I had profs.
Because sometimes I find it difficult, especially to understand them. They have had experiences outside and how things are done, but when they come back here, I don't know what happens. So when you interact with them, what sense do you get? What understanding do you get when you're interacting with them?
I will just give you a general answer.
Sure.
I don't want to limit it to any one particular individual.
No problem.
But this is general. It goes to all of us. I always say that we can have beautiful policies, which we have here in our country.
Yes.
But if we don't change our perceptions, our mentality about disability, then we will continue to have these beautiful policies and laws sitting on our tables doing nothing. Because the way we perceive persons with disabilities impacts on how we interact with them and how we treat them, right? So if the perception is that disability impacts on the entire being of a person with a disability in ways that they can do nothing, they cannot even decide for themselves, in such a way that even when an adult with a disability interacts with other people, it happens in several environment settings, they would rather want to talk to the aide. I remember some time ago when my daughter was 18 years old, I went to the salon with her. At that time, she wasn't driving, so I drove.
Okay.
Went to the salon, I parked my car, walked out. The hairdresser saw me and my daughter coming in, and then I made her aware that I was coming to braid my hair. She turned around to ask my daughter,
discrimination.
What style does your mother?
After you have told her you're going to braid your hair.
Exactly. She didn't see me as a person. And this is happening everywhere. There are several, countless examples.
Even at that higher level, it happens there?
Which higher level are you talking about?
That those who take the decisions, the politicians and our leaders out there.
Well, you can guess for yourself, but I'm just giving you a general scenario. That our mentality about disability, that is what is creating all of these issues. Stigma against persons with disabilities, discriminations against persons with disabilities, and until we break these walls, we are going to continue to struggle. We will have these beautiful laws, but then we will continue to have these issues.
All right. James, same.
Yes. Okay, so talking about the recognition, I think that my feeling is that maybe they don't really appreciate the problem. And I'll give you an example.
Please do.
Now, we have, as Dr. Nami said, we have only 3 mental hospitals. 2 of them are in Accra and 1 in Cape Coast. The northern, they don't have any mental hospitals.
It has been so for so many years.
How many years?
Yeah.
How many years now? So, yes, maybe they don't appreciate the need, or maybe we've not advocated enough, perhaps, because they need to appreciate that there is a need. And even our constitution talks about what this regional balance, all those things. And so I think that for me, my feeling is that I think they may not appreciate, or they have not yet appreciated the issues. And so this platform is a good platform for us to advocate that, yes, these are issues that our politicians, our duty bearers, they need to sit back and look at and say, for how many years now, what have we done about mental health? We have 3 hospitals, 2 in Accra, 1 in Cape Coast. How about the other parts of the country? So we need to draw their attention. We need to let them recognize and appreciate that there is a need to invest in mental health. Yes, we need to draw their. So that's my feeling.
That's your sense. Prof.
So let me, based on the assumption of what James said,
Yes.
let me say that I'll talk about 2 issues.
Sure.
Even if they do understand, I mean, there are some, one of them is a limit, but the other one is more like, I mean, this issue of donor reliance, it can actually negatively affect us a lot.
How?
Because you see, recently, I interacted with policymakers in the Ministries of Health, Finance, in 6 countries in Eastern and Southern Africa. And the story was the same. That you go to Ministry of Finance, they say, oh, as for Ministry of Health, don't mind them. Because even if we don't, I'm not saying this is Ghana, I'm saying this is elsewhere, but it's general.
It's general thing. I mean.
You know, even if we don't give them money, or they ask for 20 cedis or $20 and we give them $10, they won't even come back to us, because we know that there are donors there to always support them, even when they're about to fall. So
that's the mindset.
So the mindset that donors are always there to support, you know, could actually make someone, not intentionally, but somehow behave like they don't really care. Because the donor is always there, but what we always forget is that someone who is helping you is different from you helping yourself.
That's true.
The other issue that I think we need to, and the issue of donor reliance, I mean, as a health economist, I work primarily in malaria, in mental health, and in vaccines. But I have not yet seen the level at which we rely so much on donors on mental health like other areas. And I'm not comparing, but I'm just being frank. The other issue that we also need to recognize that government is not a business. You know, government spends what it gets.
Yeah.
So if you ask government to give you $10 here, and government is not getting something additional, government will have to rob from somewhere else. Rob Peter more or less to pay Paul. So I think that as a health sector, maybe we need to begin to consolidate the way the pressure we pile on policymakers. And I am happy. I know this is debatable. People have different opinions, but people like me have been advocating for a long time that we need to expand the health cake. And I'm happy that this year's budget actually provides for 2 new taxes: the 1% VAT and what they call the COVID, you know, the NHI. I'm a person who also pays taxes, but I know that globally, the best ways and the most equitable ways for government to finance, to improve financing of healthcare is actually through taxes. And so, whereas, you know, it affects us negatively and all that, government does not do business, doesn't run a business that gets profits. So the way for government to do that is to get some money somewhere and actually allocate more to health, because I believe that once government's allocation to health increases, mental health will benefit. So it's important that as we do this, we also appreciate the fact that policymakers, especially from finance, they also the country also has a limit. But in all of this, we are saying that a bit more needs to come to health generally, and also mental. I mean, we don't give a lot of money.
On the issue of taxes, how sure are we that these monies will go into the sector, the health sector, for that matter, addressing some of the issues we're talking about?
So those are efficiencies.
Yeah, because someone will also argue that government has got other competing priorities too. So how sure are we that these things will actually go there?
True. Those are issues of efficiencies. But I can also tell you that the country has procedures. I mean, the public financial management systems, there are laws, you know, and there are monitoring systems, the parliamentary select committees and parliament itself. Because you see, every year, the ministries go back to parliament and they tell you how much are actually allocated. So I think that if we engage all our systems, monitoring systems, to check and be sure that we actually allocate. Now, whether or not what we even allocate eventually ends up being used, because we could allocate, but a lot of it will go into vehicles or something else. So I think that the first step is to allocate. But once we do that, we need to engage all our systems, the efficiency systems within the health spending sector and the monitoring systems, to ensure that these monies actually go to what they are supposed to. So I think the first step is to make it legal. Once Parliament approves it, Parliament and other state and non-state actors, including civil society organizations like us, have a duty to monitor to ensure that these actually go to what they are meant to go.
All right. James, for those who are watching us and are still wondering, when we talk about investment, which we've explained further, which specific areas can this investment go into, based on the subjects and the topic we're talking about?
Okay, I think that one, infrastructure. We know that there's a deficit in terms of infrastructure for mental health across the country. So we need, and even when we talk of the infrastructure, it must also it's also linked to accessibility. Those structures need to be fit for purpose. I mean, fit for persons with disability as well. So infrastructure is one. Then two, it's human resource. The nurses, the doctors. How many doctors, mental health doctors, do we have in Ghana? 12.
12?
Just 12.
The whole country?
I think so. I'm not too sure, but I read somewhere just about 12. I'm not too sure.
Psychiatrists, yeah.
Psychiatric doctors. Wow. So we need to invest more. So human resource, we get more nurses, more psychiatric nurses, more psychiatric doctors. That's number two. And then number three, we need to look at the drugs, the medicines that go into treatment and care of persons with mental disability. So for me, these are the three areas that I think. So infrastructure, human resource, and then services. I mean, services.
All right. But now, I mean, which areas? If there's an addition.
Yes. I will go back to the issue of stigma and discrimination. So I would like to see more investment in that
area.
Yeah, in that area. Why is this important? Research indicates that stigma and disability, stigma and discrimination are the main source of exclusion of persons with disabilities and those with mental health conditions. Main source of exclusion in mainstream or participating in mainstream society. So it's important that we create more awareness about the capabilities of persons with disabilities. I always also tell people that there's a lot of negative imagery of persons with disabilities and those with mental health conditions. And once we continue to feed people with this negative imagery or images or portrayal of persons with disabilities, it affirms the stereotypes and those negative perceptions about persons with disabilities. So why don't we begin to portray the positive aspects, the success stories of individuals with disabilities and those with mental health conditions. If we continue to paint these positive pictures and talk about their success stories in the media, everywhere, so what we see will no longer be a person with mental health condition who is stripped naked
or chained to a tree.
or chained and so on and so forth. But we see them on our television sets everywhere doing something meaningful, which of course is the case because many of them are doing very good things. You know, so I would say that let's invest in that area, because it's very, very important. And like I said, if we don't change our mindset and our perceptions about disability, we will continue to have a lot of issues. And then the other thing that I would say is that it's important that mental health issues are integrated into primary health care. And this is also very important. Why? Because then that means that at our regional hospitals, we will have units for mental health care. In our district hospitals, the same. This will go a long way to reduce the stigma that we are talking about. Oh, let me go back and just say that we shouldn't just have units sitting there for nothing, but the units should be equipped, you know, with assessment protocols, and then with services and with personnel to manage those places. And the benefit is that we've already talked about treatment gap of up to 98%.
98%, yeah.
So then services will now become available and is availability, and then since we didn't have to travel several miles to the regional capital, Accra, to the national capital, Accra, for services, in my village, Lonto, a couple of miles away, you can access mental health services. It reduces cost.
I remember last week, someone sent a message that the father is the aged father is not well, and so movement is a problem, and they had to come to Accra to seek medical care. Now they're going to use a flight. The airline was not ready to get them into the plane because of movement issue. They have not provided space for him. It wasn't even accessible.
Was not accessible to.
And the man needed urgent medical care.
You know, I'm laughing because it happened to me.
Oh, it did? You mind talking about it?
I wouldn't mind.
Okay, tell us what happened.
It happened to me.
What happened?
Several years ago, I think about 4 years ago, a friend's mother's funeral. And I thought that, well, the easiest way to travel is by air because the funeral was going to be in Tamale. So I scheduled my ticket. I told them that I have a disability. I did tell them, and I even specified the form of disability. Told them that I use crutches. I disclosed everything. They went ahead, scheduled the flight for me. On the third day, I went to the airport, and at the counter, one of the attendants said, no, you have to wait. But then everybody was boarding. I have to wait, why? Then I was told that you cannot board the flight. I said, why? Because of your crutches and so on and so forth. And I said, no. You let me just have a picture. Let me see the flight.
See the flight.
Because I've traveled a lot, so many times, and in this country, persons with disabilities, most times what we do is to manage, because there are several barriers that you have to find ways to manage, improvise all the time so that you can access the environment. So I said, you just let me see the flight. I have traveled a lot. I have managed several times. Maybe I can manage. They said no. They won't even allow me to go and see the flight. But I do know personally that once there's a handrail, and I remember Mr. Sambian talked about that a lot last week. Yes, when there's a ramp, steps or something, there should be a rail. When there's a rail, the person with a disability, and even aged people, like he was saying, they will use that as support.
As a support.
So once the airline has steps and then a rail, I can manage with a rail. They still insisted no. So the lady asked me to wait, you know, and they were so rude. And she said, we have to refund your money for you. Oh yeah.
So you didn't actually...
No. They didn't even allow me. They didn't.
And they refunded your money?
Die?
And they refunded your money to you?
They did give me my money. So, I mean...
Did you talk to any of the management?
Of course I did. I don't want to talk about the rest of the story, but yes, I mean, I actually asserted for myself after that, yes. So they even had to pay my taxi fare back because, well, after that I really did a lot of, we really had a serious conversation. I think that's what I was saying. But I don't want to discuss the rest on air, but yes, we had a serious conversation after that.
And there's an airline.
Yeah, so then, now, my friend's mother's funeral, there was no way I would say I wouldn't go. So I had to find ways, 13 hours of land travel or whatever.
Well, you still made it?
I had to. I didn't have any option.
Wow. I like the determination.
So what I told myself was, okay, what is the public trying to tell us? That if you have a disability, you don't have any rights again. The perception is that persons with disabilities are incapable of doing things.
Yeah,
if I can travel for 1 hour to go to the north and do whatever business I have to do, and you are depriving me of that. You want me to travel all these hours, wasting of time, fatigue, risk. Talk about all of that. You know, so the society deprives persons with disabilities their right to participate meaningfully in the society and to contribute to national.
George, I just want to add something about this stigma and this thing. A blind lady entered a public bus. You know, these mass public buses. You know, those days, you know, there are just a few seats, and most of the passengers will have to stand and hold hold something. So this lady entered the bus and got a seat because she entered from the start of the journey and got a seat. And then as the bus was moving along, other people, passengers entered, and you know, people entered. Then they got to a point, and a lady had a baby on her back, was carrying something and was holding something. So soon as the lady entered, she was looking for a place to stand.
Okay.
And then this blind woman was sitting at the corner. So she pushed the luggage that she was holding, she put it in the hands of the blind lady so that she could get a place to stand. Then the other passengers in the bus, don't you know she's blind? So the lady quickly, you know, collected her distance. And the blind lady said, so if I'm blind, I cannot hold somebody's luggage. Even if I'm blind, can't I hold somebody's luggage? So I think that people, what she was saying, it is we the people who are creating all these problems and trying to stigmatize and make it look as if persons with disability are not capable. But just to hold somebody's luggage, is that also a problem? Must I be cited before I can hold somebody's luggage?
I get it.
So, George.
I mean, we are in a country where comedians make comedy out of people who stammer. And we think it's funny.
It is not.
And you see comedy videos and comedians standing on stage and making fun out of it. But to a stammerer who's sitting down watching, it's painful.
Yes.
Because they struggle. And most people do not actually even know that. And we think it's funny. We think it's funny. Anyway, we'll get there. Prof, I mean...
not only that, can I quickly just add this?
Please do.
Language is powerful. Language is powerful. So just like you said, some of the things that we even say about persons with disabilities. Some of them sometimes dehumanizes the person and demoralizes the individuals with disability. So yes, it's high time that we actually, as individuals, just think about the way we perceive and treat persons with disability. This stigma that we're talking about, it permeates all sectors of the economy, even in the church.
Church too.
Oh, yeah.
2 years ago, I did a research for the UN Special Rapporteur on the rights of persons with disabilities. And the research was about disability-specific deprivation of liberty. And yes, I realized that even in the house of God, yes, people do experience stigma. So the stigma goes beyond the individual. It affects the family members, even service providers. We hear people say, "Abadam for nurse," or "Abadam for doctor," and all of that. Once you are associated with a person with a disability, you are also stigmatized as a person with a disability. That's why this issue of stigma for me is very...
Just received a text message. This one says that, do you know that just yesterday, ushers nearly prevented the OT regional minister from attending the program, but for the timely intervention of Bernard Avle?
Can you imagine?
So,
They didn't even know that he's a
They didn't even know that he's a minister.
Well, how would they know? But they didn't need to know it.
They don't need to know.
Well,
Yes.
I'm glad to know.
Yes.
I'm glad, yeah.
And
yeah.
usually when I go
You don't
out,
even need to know.
yes.
I'm glad,
and
glad you
usually when
touched
I go out to transact any business, I just go as Augustine Anami. I want to see how people will treat
Who
me.
treat you?
And they'll treat me like any person with a disability. But once they hear Dr. Nami,
Hey, hold on. Yeah. That's the thing, you know. Anyway,
No,
bro.
I think that we need to, well, in addition to all that they've said, we need to seriously reconsider, I mean, the way our facilities, existing facilities, I mean, in this day and age, I don't think the focus should only be on even building new psychiatric hospitals. Look, we have district hospitals,
Yes.
Regional hospital.
scattered across regional hospitals. How much would it cost us to provide an entire unit, maybe even a ward,
Yes.
for people with mental conditions?
Disabilities.
Even expand, the capacity of the staff to communicate with people who are deaf and dumb. How much money would it take us to train people, to put, infrastructure that people can feel comfortable using? I think we need to seriously, in addition to the new facilities we are building, we need to really, and Dr. Nami talked about, they both talked about that, expanding that. Look, the mental health policy, was it 2012?
2012.
Yes, 2012.
Made provision for what they call institutionalization of mental health.
Yes.
It means that community mental health. We have CHIPS compounds.
Yes.
How many of them are equipped with the personnel and the facilities to, at that level, within the community, no travel, see to mental health care? I think these are serious issues that we should make provision for.
Yeah.
And the last thing I want to talk about is empowerment. You see, the people with mental, of course, the advocacy and the other things, we are talking about champions. We need champions, people who speak for people with disability. We need people like the president himself or some high-powered people who would always, make a case for people to treat, because look, all of us have some form of disability.
That's what most people
We
know,
don't
right?
see
Yes.
ours,
Yes.
but we have.
And all of us have got some. We've got some bit of mental health
Exactly.
challenge. Yeah, all of us.
For those who at least have gone to, because some of the conditions are such that they are quite debilitating. Now, if someone, for instance, with schizophrenia gets, and they can get treated, they can get managed. How do we empower these people to go back to some form of business, something that they can do at their level, to bring back their families? If someone has not only a mental health disability, but other disability, how do we put money into empowering? And there are many non-governmental organizations, civil society organizations that are working closely with the mental health authority and other agencies and working with communities. So can we, put some money? Can we set aside some money to help people, get empowered at their level, so that this whole burden on everybody? And I think that we should not only be looking at government. I always advocate that, look, the private sector, they are also suffering. Like I said, their profitability.
Yeah.
We need to expand facilities in our businesses to ensure that we accommodate people with mental health conditions or disabilities generally. So there's a lot for us to do, but I think that, at least we need to begin the step. You say a journey of 1,000 miles begins with one step. So each step.
Last week's conversation, there was one thing one of our guests, the lawyer,
Yes.
she said that
Yes.
Dapa, that really touched me a lot. She said that if she travels out there, life is easy. Everything is just fine, and she gets the sense and the feeling that people care about her, and the system cares about her. But when she comes to her own country, it's a different story. So if she gets the choice, she would prefer to move out there rather than to stay. And I was like, that's so touching, because even your own home, you don't actually feel such welcome, and in someone else's home, everything is just made available there for you. It's something else. And Doc, let me just find out this. I mean, from the other side, sometimes, yes, there are people who discriminate and all that. But do you also sometimes get the sense that they don't necessarily want to discriminate, but it's just that they don't know how to show that kind of help and the love?
Sometimes,
or this, because of their act, it comes out as being discriminatory, but their intention is not necessarily so.
it's also possible. It's also possible. I do a lot of awareness raising. I do a lot of awareness raising trainings and so on and so forth. So sometimes you realize that people don't understand certain things about persons with disabilities.
Yeah.
So that could also be
Yeah, problem.
the case.
Yeah.
But most of the time, it's the other way around. But yes, of course, I wouldn't refute the fact that some people don't understand. And I'll give you some examples. Sometimes, maybe most of the time, because our buildings are not accessible, when individuals with disabilities, let me give an example of maybe somebody in a wheelchair, try to access those buildings, Ghanaians will not avoid the person. They will try to help the person.
To help the person, yeah.
Right. But in so doing, sometimes they end up hurting the person because they don't know the right way to handle a person in a wheelchair.
Yeah.
How do you carry a person in a wheelchair up of a story building?
Staircase, yeah.
There are some measures that we need to take, but sometimes we don't know, so we just quickly rush, hold the person or the wheelchair and carry the person. So other times, this kind of act does have a lot of implications on the individual with a disability. Because in our culture, what do we carry? We don't carry people. We carry objects,
Clothes and stuff like that.
dead people,
Yeah.
children. So as we carry this individual, all of these thoughts run into the person's mind. We think that we're doing the person a favor, but at the end of it all, it could be something else. So yes, there are a whole lot of issues around us, and that's why we're calling for access. So that a person with a disability will go wherever they want to go in dignity and respect. Because sometimes even as you carry the person, for me, one thing that really, really, really kills my soul is this. Other people will be watching, they will be staring at what is going on. As if you're not lucky,
really enjoy
you're not lucky, some will even laugh.
And they'll be taking pictures.
We'll quickly wrap up here. So I'll pick your final thoughts and your final comments. And I'm glad one thing that Prof said, that we need to see those in society, the big men and big women, those influential people in society, making a case and making comments about some disabilities and all that. And I like one thing that Joe Biden of US, the US president, actually did. He's a stammerer, and he championed that, and there was a little boy who was also a stammerer and realized that the president actually is a stammerer. And the president confidently and boldly talks about it in public, and the effort that his family, especially his mother, put in place to ensure that he's able to speak and all that. And this little boy looked at the parent and told the parent that, so that means that he can also become a president one day. Just because of what Joe Biden did.
That is motivation.
Yes, just because of what Joe Biden did. And he managed to get in touch with Joe Biden. And Joe Biden actually met him. And for him, that was just enough. Because according to the boy's parents, the boy was just hopelessly living in a way. But just when he realized that the president is actually a stammerer and he's just like me, he told the parents, so that means one day I can also become a president. And these are some of the things we need here.
Yeah.
I mean, if we are gradually seeing things like this, we'll have a lot of change. So I think a final words from all of you that we can wrap up. James, I'll start with you.
Okay, I think my final word is that when we want to invest in persons with disability, I think one of the first things that we need to do, or we need to concentrate on, is awareness. Creating awareness, raising awareness about the issues and about the need. Because if we don't raise awareness, when we raise awareness, we are able to get people, to get the buy-in from people. Then we will succeed.
Okay, all right. Doc.
I would say that every life matters. Every person with a disability matters. So we need to embrace disability. We need to embrace diversity. We have to break those walls, the walls of discrimination, the walls of stigma, because they exclude persons with disabilities from mainstream society. It's high time that we all embrace disability and difference. Persons with disabilities have expertise, skills, just like everyone else.
Last week I was just wowed by Lawyer Dapa.
Yes.
It was so brilliant.
Yeah, just like everyone else. So we need to give them maximum support, opportunity. You know, I always tell people that I am number 9 out of 12. My parents could have said that, well, she's number 9, we have many already, so why should we bother about her? But they didn't say that. They gave me the support that I need. They encouraged me, they motivated me. And my family is still there for me. So that's what persons with disabilities need. Give them the opportunity. And they will, the potential that they have, they can use that to the development of our nation. So I will say that, and I've said that already, that there is power in inclusion.
Yes.
The persons with disabilities don't want to continue to depend on others. They want to be independent. So let's all try to give them the chance so that they can participate like everyone else. And when that happens, we will all benefit. Why? Because they can take care of themselves, take care of their families, pay their taxes, contribute to GDP, and so on and so forth. Another thing that I would say is that let's try as much as possible to include them in decision making. It is key. It is very important. You know, sometimes the solution to the problems that persons with disabilities encounter is not far, and it's not difficult. It could be something very minute, simple. But because we don't include them in the decision-making table, we don't get to know how easy or how we can easily address their issues. When I walked into this studio last week, I told you that
you did.
Your chair wasn't
yes.
But because it was just a 20-minute time with you, I told you that I could manage. But today,
you brought
1 hour, if I hadn't done this adjustment, the rest of the day, my day would be useless. Because, well, I already want to talk about the details, but because of the, my impairment. So let's include them in decision making. They will tell us what the issues are, and they can help us find lasting solutions to their issues. Maybe you can see that I have a physical disability, but you don't know what the actual challenge or problem is. Let's also desist from having a one-size-fits
Oh.
all approach. No, it doesn't work. We have diversity in disability, and each one of them have unique needs.
Yeah.
So, well, all I will say is that we have to respect the views of persons with disabilities. Let's include them in decision making.
Prof.
Yeah, George, if you permit me, let me speak directly to whoever is in position of authority.
Please do.
It could be at the Ministry of Health, Finance, even in Parliament, parliamentarians. I think now we need to prioritize mental health.
Yeah.
We may already be doing, I don't know. If we are doing, we need to prioritize it more. I was speaking with a friend in the private sector the other day and asking, why don't you people support the mental health authority or mental health? You know what, jokingly the person asked me, but you know, as a nation, do we really prioritize mental health? Because for us in the private sector, we look at the priority of the country and we support.
Yeah.
So sometimes, yes, government needs to put in money, but sometimes it just means, you know, making people know that yes, it is a priority for you. Sometimes it could be the president or the whoever it is.
Yes.
Making statements, bold statements. It could be a parliamentarian, whatever, making bold statements that look, this area is a priority for us. Because in the private sector, they pick the statement because they want to please you.
Yeah.
So they pick those statements and run with. So I think that we need to prioritize mental health more and put in more money into mental health in this country.
Yeah. Usually I try to give hope by saying that we'll get there. We'll get there. We should get there. We should get there because I mean there are serious issues for us to talk about as a country. Very serious issues. I mean yesterday I was talking about road safety issues where you realize that just within 3 months the number of people we've lost is more than those who have died out of COVID.
And malaria.
Malaria. I mean it just and just today is Thursday, just Tuesday dawn into Wednesday, we lost 13 people within the span of 13 hours on the road. And these are serious issues we need to talking about. And I hope that we'll get there.
And George, even the media,
I agree. The media too.
You need to.
I agree.
You need to prioritize some of these issues and talk, because you are icons.
Yes, I agree. And most of the time we think that mental health is really far from us. But close. You might be surprised that you who's even thinking that mental health is far from you might even have some bit of challenges that you're not even aware of. Yes.
Exactly. And you know there's a thin line between being a person without a disability and getting a disability.
I agree. It's just a matter of seconds. Yes.
Exactly.
Thank you very much. And we wish you all the best.
Thank you.
Grateful. I've enjoyed this conversation. Stay with us. We're still having breakfast. Don't go anywhere. Our next guest is going to join us. We're going to have another good